Sometimes when people bend forward and they have a herniation in their disc, it's not because that one time bending over herniated their disc. That's the straw that broke the camel's back. It was tiny tears that have been building up over time that this one event, the spine was just like, I can't have it anymore. And that jelly donut's just been squished, and that jelly comes out of the donut. On this model, you can see the vertebrae, and you can see that gummy bear material in between. And you can see how when you bend to the side, or when you bend forward or back, there's a movement that happens in that disc. Most of our spinal movement is actually because of that gummy bear material. You can also see that when there's an up and down compression force, like when you jump, that disc can take some movement. Herniated discs can be very painful. What can happen is the jelly inside of the donut is pushed out, and it usually pushes out either on a nerve, how we had these nerve roots, or sometimes it's pushed out centrally, which goes onto the spinal cord. And that can cause a lot of pain because the nerve tissues are very sensitive. And that's why people can get numbness and tingling down their leg, or if it's more centrally located, they can have symptoms in both legs. When you have a disc herniation, that doesn't mean that you should stop moving. Actually, sitting on the couch can be really painful because what happens is the pressure of the rest of your body can compress down on your spine, which can actually cause more of the fluid to push out and can cause even more pain. Another thing that can cause irritation and microtrauma to the disc can also actually be prolonged bad posture. So Pilates is really powerful because not only does it increase someone's awareness of their body and help improve their posture, but it helps the nervous system be able to hold that posture, and it retrains the body into how it's supposed to be instead of how we've adapted over time, because we slouch when we type, we slouch when we watch TV, and we're just not conscious of the fact that we need to actually hold our bodies up. So it helps bring more awareness to that, so that when you're not in the studio, that your posture is being maintained and you're not having to think so much about it. One of the most powerful things that I love about Pilates is that when you come and you work out and it addresses the nervous system, it addresses the nerves, and it helps reteach the body, that when you walk out of here, you're not done exercising. Your body is maintaining that new position that you've taught it. It's maintaining those new things that you've done with it. And that lasts not just in the session, but long after the session as well. I recommend doing exercise when you have a herniated disc, but it's important to know what exercises you need to do and not just do any exercises, because just any exercises could damage the disc more. I am a physical therapist and I use Pilates all the time with my patients. It's so beneficial. Pilates can address the body in a way that typical exercise can't address. It can address the small things that the body needs to be addressed. It can help actually open up that spine at the level of each individual spine to help take that pressure off the nerve, to help take that pressure off the disc. So Pilates is really beneficial, and most people don't really think of Pilates as being a therapeutic thing, but it is so therapeutic because, like I said, again, it addresses the body in a way that other exercises just can't address it. And it also doesn't just address the muscles, it addresses the nervous system and teaching the body how to move properly at times that you're not just working out. Pilates is mainstream, and you can find Pilates anywhere. You can find Pilates at almost any gym. You can find Pilates studios almost anywhere you go. The important thing, especially if you have an injury, is really finding someone to work with you who has had extensive education, because Pilates is its own entity. So you can get credentialed, and you can get educated and get even further education. So it's important that you actually interview the people that you're working with and that you find out where they're at and deciding if they're a right fit for you, because you don't want to take an injury to someone who does Pilates, but they do it because they want to get in shape, and they just do a global fitness class. It's really important that you find someone that is going to know what's going on with you and how to take care of your needs and what's going on with your body, because you want to help facilitate your body in its process. You don't want to hurt your body in its process.